All right, good afternoon, everyone. I will now call to order the March 24th, 2026. I'm sorry, March 24th, 2026 Public Safety Commission to order. Clerk, please call the roll.
Chair Holguin,
Present.
Commissioner Lu, Commissioner G,
Present.
Commissioner Cervantes,
Present.
Commissioner Senko, Commissioner Reza.
Present.
We have a quorum.
Thank you, David. Are there any public comments this evening?
No in-person public comments, but 3 on Zoom.
Commissioner Sanko states that he's listening online.
We have a Zoom public comment from Yvonne LaRose. Ms. LaRose, you can unmute yourself.
Thank you. I am looking forward to seeing how things progress this evening with regard to the plans that were mentioned in the past. I did submit 2 public comments, written public comments for today's meeting. I hope that those thoughts can be addressed today. Thank you.
We have a public comment on Zoom from R. Kwan. R. Kwan, you can unmute yourself, please. R. Kwan, can you unmute yourself, please?
I'm sorry, I have no comment. I'm just watching.
Thank you.
Great, welcome, thank you. David, any further public comments?
No further public comments.
Okay, seeing no further public comment, moving on to agenda item number 2. I have the privilege of welcoming Derek Elmore as the new chief of the South Pasadena Police Department. I believe he is walking in momentarily.
Yeah, we can come back to it.
Okay, let's table item 2 for a moment, and let's move on to item number 3 on the agenda. I'd like to welcome Tim Schofield as the new Information Technology and Systems Manager for the City of South Pasadena. Mr. Schofield will make a presentation providing an update on the city's IT and cybersecurity posture.
Hello, good afternoon, Commission. My name is Tim Schofield. I'm the IT Systems Manager for the City of South Pasadena. Been on board since October of 2025. A little bit about myself, I have about 20 years of public service experience working in K-12, higher ed, and most recently here at the city. I have a bachelor's degree in network communications management with a master's degree in educational technology and learning. I do carry a Security Plus certification. I'm a certified chief technology officer. I'm a certified security grant writer, and most recently an FBI InfraGard member. So the goal of today's briefing is really to share the journey that I've partaken with the city of South Pasadena for the past 6 months, as well as an additional 3 months of where the city has started to go with our IT and cybersecurity infrastructure. And also to give you a look ahead at where we're planning to go with year 26, 27. So coming into the city, we've inherited quite a bit of technical debt. As you can see on some of the graphs, we had a high percentage of phishing and ransomware spam exposure. We were able to implement some security training for staff. We were able to do some phishing campaigns and drastically reduce that percentage from more or less 60% of all staff down to about 16% through that active campaign, which industry standard is about 15. So there's still a little bit of room for growth in that measurement. Additionally, we were able to do a national standards for technology 2.0 cybersecurity framework audit and look at vulnerabilities inside and outside of our network. And we were able to identify close to about 220 main vulnerabilities that we needed to address through remediation. Since October to today, we've narrowed it down to about 75 vulnerabilities, with 8 being critical. And I'll share a little bit of the plans to wipe those out to get us down to 0. And additionally, we were very policy poor in terms of IT. This is the first position that the city's carried, having an internal IT manager. Before, it was managed by an outsourced vendor. And so developing some policies both on information security side as well as how we manage our contacts and contracts through outside vendors and consultants was critical. So we implemented 4 IT governance policies to help manage that process. A little bit on the network security and cost recovery. So with a lot of technical debt coming to the city, a big audit and exposure analysis needed to be conducted. And the first thing that we did was we looked at where we're spending the most money, and it was about close to $1 million in telecommunications that we were spending. Through that analysis, we were able to find that there was a considerable amount of waste going into old telecommunications lines, phone lines, direct connect lines, I'll address in the next slide, as well as looking at who was managing our infrastructure in years past. So we took a look at the managed service contract, put out a proposal to right-size that, and the winning vendor ended up being LAN WAN Communications. So moving away from old Acorn technologies, bringing on a new vendor, right size for the city, for its needs, and exactly where we wanted to go with the posture of cybersecurity first, network infrastructure, public safety, and then advancing that innovation spectrum moving forward. So back to that telecom and more analysis on where that cost savings came from. So there was 97 lines audited. We were able to find about $280,000 of savings. So if you're familiar with the city, a core component of that savings were those code blue line phone poles that you see scattered throughout. There's 2 over by Stony, so over by the skate park, and then 1 on your way up Stony Drive. There's 1 off of Mission and Pasadena. They're basically big blue poles with lights on top, and it was a call button. One of the things that we found was that there has been no activity to these poles since 2023. We were able to call trace back with our police department to the call logs in our 911 center for emergency and non-emergency dispatch. We hadn't had a call since then. So we went out and evaluated those poles, and we were able to find that not only were the poles not functional, but the lines that connected to them were dead. But we were still paying money. So we engaged AT&T, our service provider, to cancel those lines, and we're negotiating getting credits back for past years. That's number 1. Number 2, we engaged the vendor of the code blue poles to look at a new technology to help service and fit that need for those press-to-talk emergency communication lines. And 3, we put signage on those poles so that way the community was aware that those poles were not functional, they're under maintenance, and so that there wasn't the air of I'm in distress and I need help, and that this pole is going to contact emergency services. So we did those 3 things on those lines specifically. Additionally, we did some line audits on our 911 communications, both on the PD and on the fire side, and we found that we were paying an extreme amount of money for two non-serviceable lines from fire to our Verdugo Fire Communications Center, kind of a JPA helper agency that South Pasadena is a part of. So with those significant reductions plus the additional other telecommunications lines that we were able to move off contracts, we saved close to about $280,000 annually. Now, from a public safety compliance, I wanted to just bring awareness of the many different policies and frameworks that I consider, when we're putting policy forward and when we're making decisions for the betterment of not only public safety, but also the city as a whole. So if you look at the graphic on both ends, we're bookending from NIST 2.0, which is that National Institute for Standards and Technology, and CIS, which is the, Center for Internet Security. That bookends not only what we're doing with CJIS, which is our police, our criminal justice information services. We look at the National Fire Protection Association, which services fire, but then also the CPRA, which is California Privacy Rights Act. So all of those policies and frameworks is what guides my work and what should be guiding our city as we put forward policy, as we enact new initiatives, and help guide our work plan year in and year out. So I just wanted to put this in front of the commission just to let you know that this is our guiding framework as we move forward. Also, some of the things that we've been doing under this framework is those 4 policies that I had mentioned: our hardware refresh policy, our internet security policies, and both of our data sharing and our cloud agreements with third-party vendors. On this front, also, I'd like to also address what we're doing on a physical access control side. We just implemented a library access control project, so utilizing card readers and badges. We do have some here at the city, but it's not a uniform system, so we're doing an evaluation to not only look at the policy and the framework, but then take that standard and move it citywide. So the work plan for IT and public safety and city for 26-27 is really looking at how we can build network resiliency. A lot of the information that I've received from InfraGard, CISA, and some other big governmental agencies is be aware of critical infrastructure. You know, word on the street is Pasadena, South Pasadena, we are going to be having the World Cup coming soon. And so the big awareness is looking at critical infrastructure, how we're protecting those, how we're keeping lines of communication open. And so it's really looking at how we can build resiliency. So if one path of communication is down, how we can piggyback and look at another line of communication. So my big work plan really is looking at our 911 services, building resiliency. I know PD went out for a Cal OES grant that was funded. And so we're looking at building that out. We're looking at taking down some of those old analog lines that I had addressed earlier, building in some fiber optic lines to help build that resiliency. And then just looking at overall how we can do things better and more efficient with better technologies. And the last big project that I'd like to bring up, and it's not really centered around public safety, but it does include public safety, is our customer success initiative. So if you've heard through past city council meetings and other meetings that we've held here at the city, really we wanted to address how we're engaging our residents and understanding how residents want to engage the city. We understand that right now we have vacuums of communication. We know that we have lines. When you make a call or you email somebody, sometimes you're just shooting in the dark and you can't find the information that you need. And so really the premise of this customer success initiative is to have a one-stop shop for web, email, and phone, so residents know that they can go to that success center and get the same experience day in and day out. And it also informs the city. So this gives us real-time visibility on what our residents need. It lets us know where the demand is the highest and helps us address that need ahead of time rather than hearing about it down the road. So with that, I'll close my presentation and I'll open it up for discussions and questions.
Yeah, I appreciate that, Mr. Schofield. Thank you. Any questions from colleagues? Commissioner G?
I had a question. I know that you got a lot of funding back from the AT&T back credits, but then we will be spending more money on the fiber optics. So can you explain to me how we're going to be financially fiscal?
Correct. So the money that we saved, let's put it this way, we had a $500,000 budget, but it was unrealistic because really the budgeted amount for our telecommunications was going to be closer to about $850,000. And so we were going to have to ask to help fund the rest of that telecommunications unless something happened. I came in October, so let's say July, August, September, 3 months had already transpired before any actions were taken. And within the first 2 months, I would say we started making our first big deep cuts in December. So it was really from July to December, we had actualized costs of that higher amount. And so the savings didn't really take place until January. So the $300,000 savings was really the elimination or removal of the ask for the additional $300,000 that we would have had to budget for an underfunded telecommunications budget, if that makes sense.
Does this go into what the finance committee decides?
I'm sorry?
Does this go into what the finance committee usually looks at?
Right. So we had made the same presentation or similar presentation to the Finance Committee when they were doing their budget book analysis. And so we had shared these findings that we had saved this money and it was going to be unactualized budget that we would have had to ask for. So it was a savings, quote unquote.
You good, Commissioner G? Any other questions from colleagues? Dr. Sanko?
Steve Sanko. I apologize to my colleagues and also Mr. Schofield for running late. I thought this meeting started at 5:30. That's on me. I was listening in online and I heard that some of the blue lights for safety around town weren't working. Have we checked all the others that remain?
Yes.
To ensure that they're functioning? So we just had 3.
No, so we had 5.
5.
We have 5 total throughout the city. All 5 were non-functional. And non-functional from the AT&T side of things. So there were defunct lines and AT&T cannot give me a clear answer in terms of was there an initiation to stop service or was there a cut that was not monitored or reported to the city? And this is before me or much of leadership in city. Now, of those 5 from a functional state, 3 were not functional. Lights tipped off, buttons not pressing, if you were to test the internal components, you would not get a signal. So the remaining 2 are functional, and that's the one I want to say. The one on Oak, 1800 Oak, is functional. And the one on Mission in Pasadena was functional from a hardware sense. Now, telecommunication line reaching those, all 5 were out. And so we've been working with Code Blue, who's the manufacturer of that pole, to say, can you provide us a alternative technological solution that doesn't require a $6,500 a month line to connect that pole to here at City Hall, something more LTE, cellular, wireless type technology, which is completely feasible, but it would require a brand new pole because of the internal components.
The plan moving forward then is to collect further information on the costs and bring it back to
Correct.
the city? Okay.
Absolutely. Yeah.
Thank you.
Any other questions from colleagues? No? If we could go back 2 slides for a moment on the looking ahead slide, I have 2 questions. It's the third to last slide. There we go. You have it up, Mr. Schofield, you good?
Yeah, good.
So the first bullet on the right side, excuse me, the second bullet, 911 routing and dispatch upgrades serve both police and fire through Verdugo. Excuse me, long day. Is there any cost sharing with Verdugo as an entity?
So I know, and Chief Lloyd might be able to address that as well. But I know that we pay a significant portion to Verdugo for services rendered. So they do service our fire, dispatch, EMS, CAD systems, and we pay for that. We also pay for the data transmission line from us to Verdugo, and we're paying as part of that fee an FTE or a salary or a body to help manage the dispatch on that end. So we're providing the telecommunication piece, and we're also paying a share towards that.
Okay, so we're not paying for San Marino's phone line and other phone lines.
Yeah,
in Verdugo.
every entity will have their own means of communication to Verdugo for that transport.
Got it. Thank you. And the same side, the 911 services enhancement, last bullet, coordinating with Verdugo on next gen dispatch connectivity for police and fire. Are we? We're not talking about combining the dispatches, right?
No, it seems like we are, but so when 911, we have a direct connect here that lands over in 1422, which is our PD department, and that's our 911 line. All 911 lines will come in over that. It's then determined whether it's going to be a police emergency or a fire emergency. Fire emergency that gets dispatched to Verdugo. All police emergencies land here.
Okay, understood. I think the wording of that bullet is
It's a little
potentially
off, right?
confusing.
Yeah.
Because I read it as talking about Verdugo handling dispatch for police and fire department, which would
No.
be a much bigger conversation
Yes, it would be.
than this is.
No,
So,
my apologies. Yeah,
Okay.
it's poor wording on that. It was more in the context of we have to make sure that as we look at a next generation connection for our 911 services, i.e. fiber optic or digital transmission, not only do we have to make sure that our handoff here can accept digital, but also Verdugo can accept digital because it has to be a like for like on both ends.
got it. Appreciate the clarification. Anything else for Mr. Schofield?
Last question, just because you seem to have a very, very focused area of expertise. Is text to 911 currently available in South Pasadena?
That I can't speak to. I don't know the 911 system that well. I would probably have to defer to police on that. No.
No.
So yeah, but I do know that through that, first bullet, that Cal OES grant that was procured for upgrading our 911 services, the police team was looking at different platforms other than our current Vesta system. And so that could be part of an enhancement that comes with that next generation.
Thank you, Mr. Schofield. Appreciate your time.
Thank you.
And welcome to the city. If we can go back then to agenda item number 2, I'd like to welcome Chief Derek Elmore as the new City of South Pasadena Police Department Chief. Chief?
Good afternoon. Thank you for the introduction. I've been here in South Pasadena now since February 2nd as the police chief. I was happy to be selected after their search for a new police chief. By way of the city of Phoenix is where I have done my last 33 or so years as a police officer, rising through the ranks. I've done just about everything through that agency. At one place or another, patrol, detective, investigations, operations, tactical, all the different things, our professional standards bureau, our policy and procedures. So I've kind of been all over the place. That's kind of my thing, being able to be in an organization long-term that had so many different opportunities to do different things. I kind of thrived in that. I like change. I like the ability to change. I like changing directions and changing cultures of different parts of the department. I'm looking forward to working with the Pasadena, the South Pasadena Police Department here. At this agency, the thing that I've enjoyed so far in my first 2 months of being here is the fact that they are very receptive and acceptable to change, which is not common in law enforcement. And I've been all over the country. In law enforcement, there's two things that police officers hate. One is change, and the other is everything staying the same. So coming here, it's been very refreshing. Everyone's been receptive. Everyone understands the need to change, to get better. They want to get better. They want to professionalize the police department. I'm looking forward to leading us into that direction and moving the department towards a more professional law enforcement agency. My goal is for South Pasadena to be the safest city there is anywhere. That's the biggest goal, and to help lead and mentor and develop the police department from within, so that hopefully when it's time for me to move on and the next police chief to be here, we can have that person come from within the ranks and be the next person that leads us to the next phase, and hopefully to bigger and better things going down that path. I'm looking forward to trying to get the department accredited. The state has come up with a new accreditation for policing, which they've just started actually last week. The notifications went out. So we're looking at that and looking at what that would take to make sure that we are not only doing the best that we think that we possibly can, but we're looking at industry standards and making sure that we are hitting those bars and making sure that we are at the top of that game. I am a firm believer in not meeting the bar, but being the people that actually set the bar for everybody else to kind of rise up to. So that's what I'm looking forward to in this new beginning. I'm looking forward to working with the commission and getting the ideas coming in from you guys as well as from the department to help make sure that we're on the right path and going in the right direction. So thank you for allowing me the opportunity to be here. Look forward to working with each and every one of you. Hopefully I can meet all of you guys individually. I've met most of you, but hopefully I can meet all of you guys and have the opportunity to talk to you and answer any questions that you may have.
Yeah, appreciate that, Chief. Welcome. We're excited to have you. Looking forward to working with you. Absolutely. But just hope that you enjoy your hopefully long time here and work hopefully with us as the commission and your rank and file through the POA and the community, and just keep an open mind when you're implementing your changes. But thank you. Any comments for the chief, Commissioner G?
Could you quickly outline what it means to be accredited?
Yes. So here in California, I'm not sure what that means yet because they literally just last Wednesday came out with that. And so I'm having one of our staff look into that to see what that looks like and what that means. Normally, there's a process, which means that they come in and they look at all your internal, your policies and procedures, make sure that they are in line with best practices, and then make sure that we have proof that we are meeting those policies. So it's one thing to have policies, and policies are great things to have as an outline, but are we internally, are we doing the things that we need to do to make sure that we are hitting those policies? What can I do to show you that my people are exercising procedural justice? What proof do I have of that? And so we have to set those standards and make sure that we have those proofs and that we can prove that we're doing the things that we say that we're doing.
Any other questions or comments for the chief, Dr. Senko?
Just welcome. We're happy to have you here. This is a tight-knit community, and we all look forward to working with you. And two things I'll say is we have some great community civic groups, Boy Scouts, Girl Scouts, Rotarians, others, Kiwanis, and also really strong and tight-knit schools. And thank you for being here with us.
Thank you.
Anything else for the chief? No? Okay. Well, thank you very much, Chief. Appreciate it. Look forward to working with you.
Thank you very much. Appreciate it.
Thank you. Okay, moving on to item number 4 now, another introduction. Please join me in welcoming Luke Kwok as our newly appointed Youth Commissioner for the City of South Pasadena Public Safety Commission. Mr. Kwok, do you have anything you'd like to share?
Hello, my name is Luke Kwok, and I'm a sophomore at the high school. And I'm very excited to be a youth commissioner on the Public Safety Commission and see how I can contribute. I'm very excited to get this opportunity to learn, about the city government and learn from the experience of these other experienced commissioners. So thank you.
Wonderful. Welcome, Mr. Kwok. I think it's a great thing that our city did, allowing all commissions to have youth commissioners. I think that's definitely something I know I for sure would have tried to take advantage of. So excited to have you and for you to lend a new perspective. So thank you and welcome. Okay, moving on then to item number 5 on this evening's agenda, consideration for adoption and discussion of the Public Safety Commission's 2026 work plan. Commissioners, you should have all received this document to your City of South Pasadena email. Do we have any discussion on the work plan? And if not, I would entertain a motion to approve the work plan as laid out. Commissioner G?
Could you put the work plan on the monitor, please?
Page 15, David. Can you zoom in, please? Commissioner G, did you have a comment on the document? Go ahead.
I'm still reviewing it.
I'd like to propose in continuation of last year that we add cardiac arrest readiness and heart safe community participation to this. This aligns with a countywide initiative that I know our fire chief and others have already participated in a number of sessions for, and I would propose that we include this in our work plan for the year. To summarize this again, I know one of my colleagues, Mike Stone, made a presentation on this last year. Heart Safe Communities is a program of community engagement to discuss and promote bystander action, recognition, activation of help, and being ready to do things such as perform bystander CPR, as well as assess access and use, readiness to use public access defibrillators.
Dr. Sanko, just so I'm clear, that's different than May's sidewalk CPR item, correct?
Yeah, sidewalk CPR, I think is a one-time event, if I understand that.
Good afternoon, Commissioners. So yeah, the sidewalk CPR there is an event that goes on that is the week for that. But our intention with that is to talk about all of the things related to cardiac arrest. So some of those things that you're talking about, the cardiac arrest study and all of that. So we can certainly encompass that as part of the sidewalk CPR, as well as all of the other efforts that we're doing for public education.
Great. Sounds good.
Are you comfortable with that, Dr. Sanko, or would you like it added as a separate line item somewhere?
I would like to add it as a separate item, heart safe communities, and have this be a recognized as a item of community engagement over the course of the year.
Okay. Chief, do you want us to do a motion on that, or can you just add it in? I think it would be fine if we did a motion, but.
Yeah, I think what you can do is my recommendation is that you make all the changes that you want, and then you do an emotion as the amended calendar. and then we'll capture all of those other details.
Okay. Dr. G?
So I know that in the September work plan, emergency preparedness is on the agenda. How, I know we've talked about a GIS technology in the past, maybe 2 years ago, and we haven't really addressed it since then. I think we have our own GIS, so maybe the chief would like to say something.
So you're absolutely correct. Part of that in the emergency preparedness is all of those things that we're doing with that. I know we're also doing research right now. Our newly appointed division chief is researching with PulsePoint and getting all of our AEDs listed on the map, tracking those down, looking at all of those different pieces. So we certainly can bring back all of those things related to emergency preparedness. And I would encourage, if there's details specifically that you want within that, just send us an email and we'll make sure to have those so that you have a full, robust report with that.
Dr. G, would you like that added to our revised plan?
It would be nice to add that to the emergency preparedness discussion.
Okay. Any other commissioners wish to speak on the work plan? Vice Chair Liu?
Yes, I have one question about the community outreach programs. Does this include the neighborhood watch program?
Hi, Commissioners. Deputy Chief Leidenheim, yes. That's exactly and would be the main focus of our community outreach is to expand or continue with Neighborhood Watch and ultimately expand with that.
Thank you.
Yeah.
Okay, any other comments from the commission before we? No? Were you,
Back. Okay, go ahead.
Gabe, did you have something? No? Okay, Dr. G?
So back in 2023, 2024, we had a consultant agency come in named Raftelis. They made a lot of recommendations for our police department regarding to organizational changes, basically recommendations. So I would like to revisit that again and see if we've made our benchmarks. So I don't know where this would come in terms of our work plan, but I think, I don't know how many of the commissioners were here back then, but it'd be nice to revisit it.
Yeah, I recall that too, and I know there were some funding tied to that. So that I think may be a question for council liaison on how we can, unless, David, you have something?
In regards to going back to the benchmarks, seeing how PD is meeting the benchmarks, is that the question?
Yes.
I can definitely add that to the next meeting. Yeah.
So the consultant that we used was named Raftelis. And I believe they had interviewed many different members of the police force as well as us commissioners. It would be nice to have that document again.
I'll make sure to add that to the May meeting packet.
Okay, anything else, commissioners? So then I guess I would, maybe the cleanest way to do this, I would entertain a motion to approve the work plan with the additions that we laid out, which is the addition of the cardiac arrest preparedness / heart safe communities initiative as number one. Number two addition is GIS. Did I get that right, Dr. G? And then number three is revisiting the Raftelis report on the police department. Okay. Would anyone care to make that motion?
making that motion.
Do I have a second?
I second.
Any further debate? Okay, clerk, please call the roll. The motion is to approve the 2026 work plan with the 3 additions as described.
Chair Holguin,
Aye.
Vice Chair Lu,
Aye.
Commissioner G,
Aye.
Commissioner Cervantes,
Aye.
Commissioner Sanko,
Aye.
Commissioner Reza,
Aye.
motion passed.
Wonderful, thank you. I'm sorry, is the youth member a non-voting member? Not voting, okay. But you have nothing to add? You're good with that?
Yeah.
Okay, wonderful. All right, moving on to item number 6 on this evening's agenda. Review of the South Pasadena Police Department's updated policy 429, the automated license plate reader, ALPR systems. Sergeant Andrew Dubois will be able to answer any questions we have on that.
We do public comment first, or?
Yeah, yes, there is a public comment from Ms. LaRose. Apologies, I missed that. Ms. LaRose, can you unmute yourself?
Yes, I can barely hear you incidentally. I think this meeting is my first time to attend via Zoom. And so I did not realize that the public comment period included written public comments. And I didn't realize that I should have spoken or addressed the 2 written public comments that I made earlier. With regard to the agenda item that we just handled, one of my comments directly affects the work plan discussion in the fact that I was encouraging a review of the protocols used when transporting patients and individuals to hospitals or to other locations in situations where an emergency has come up. It would be good for whichever agency, police or EMTs, to make certain that the person who is being transported has received in their hands before they reach the hospital their house keys, their cell phone, and their forms of identification. If those 3 items are not in their possession, it is entirely possible that hospital staff will mistakenly identify them as indigent and provide treatment that is not appropriate for a person who does have insurance coverage of some sort, compared with someone, for example, a detainee for the police department who they suspect is doing inappropriate things and needs to be put under arrest or evaluated. This is highly important because the misidentification, lack of currently available identification can cause a lot of jeopardy. And I would like to see that, especially that matter, included in the work plan for items that need to be evaluated. The other thing that surprised me about this evening's meeting, I always had the impression that the commissioners received a copy of public comments or matters being addressed for the meeting if they were written. I had the impression that the commissioners had those comments available before the meeting started. Commissioner G's comment, request for time to review the workplace plan, was surprising to me because of that misinterpretation. And it would be good if the plan that is presented before us
Thank you, Mr. Rhodes.
could be made available to the public so that they are aware of what's in it as well. Thank you.
Thank you, Mr. Rose. Appreciate your comment. Okay, item number 6, review of policy 429, the automated license plate reader systems. Sergeant Dubois.
Good evening, Public Safety Commission. Glad to be here in front of you to discuss updates or really just answer any questions you might have about our updated ALPR policy. Council last week voted partially to approve our new policy and to make some adjustments to our contract with our Flock ALPR service. So if there's any questions, I'm happy to answer those.
Colleagues, any questions? No? Sergeant Dubois, do you have the document in front of you? I'm looking at the bottom of page 3, the prohibited uses. Is that something you have?
On the policy itself?
Yeah, I believe so. Section 429.4.2,
Yes, sir.
prohibited uses. Could you just walk us through those and kind of summarize? I know that they're in there, but I think it would be beneficial if we all heard what the prohibited uses are and the justification for those prohibitions.
Certainly. So what the council's direction was regarding drafting a new policy was to coordinate with our city attorney. So we had some legal prowess, if you will, to draft this policy as opposed to just using the straight Lexipol policy, which is very generic. The city attorney, Ms. Diaz, did a really good job bringing in some legal terms and explanations for those terms. And when it comes to the prohibited uses, some of the concerns that were expressed by the public and the city council included that someone could access our data for unauthorized purposes. So that's number one. The policy just lines out that that's prohibited, that we can't have any other agency come in and either look over our shoulder while performing an ALPR search or allow them to access the system itself. Number two aligns with SB 54 and SB 34, which kind of oversees all of the ALPR data. But this spells out very specifically that we're not allowed to use ALPR information specifically for immigration enforcement. SB 54 prohibits our cooperation for immigration enforcement anyway, so this just spells that out as a specific prohibited use. Again, going back into section 3, this is prohibiting tracking or identifying individuals or groups seeking or providing reproductive health services. Again, already a prohibited use under California law. This just spells it out in the policy itself, so you don't have to go back and refer to the long legalese that the law provides. And then that blends into item number 4, which is surveillance of individuals exercising the right to protest or assemble, and that could unintentionally cause an infringement upon their First Amendment rights. Again, all things that are already prohibited, but they're spelled out as individual items within the policy.
Wonderful, thank you. I think that was important to express what the ALPR systems can and cannot be used for. Any other questions for the sergeant?
I have a question. What happens here is I noticed that in the last meeting, there was a lot of people that were actually very irate, and the point they were raising was on the sharing of information from our law enforcement with the federal government, specifically with ICE. And you reassure us that that's not the case. And I know from the reports we had had in the past, from the past chief of police, the system we had before was very, very good on catching thieves that were taking cars away or kidnapping people like that. However, the whole idea supersedes the fact that if any of this information is to fall in the hands of the federal government, and the question is, do they really can they force themselves onto this to get this information? And I think that's what the problem, the crux of the problem is that's where the people feel that the lack of trust, because they feel that their civil liberties are infringed, that they're invaded. And I truly believe that the city of South Pasadena is actually doing whatever they can for this not to happen. But we have to have some reassurance for the public, or else this question is going to remain up in the air, and that distrust or mistrust will remain. And to me, that's so unfortunate, because I lived in the city for 50 years, and the South Pasadena police from the 50s and 60s and 70s is nothing like the one we have now. Absolutely nothing. And we're moving forward. And I'm so pleased with that. But we have to reassure the public. We really need to do that.
Yes, Commissioner Cervantes, thank you. Another part of the council's direction, and actually something that we just got word today was finalized in regards to protecting or safeguarding that data that is collected, is reducing the retention time frame for how long that data remains available to us. So initially, our policy, when it was first created, allowed for a 1-year retention. That didn't align with the law, and it also obviously didn't align with what the city wanted. The default retention period was set for 30 days. That's what we operated with up until recently, with direction of the council and public input. Last week, the council approved reducing that retention period down to 15 days, and we actually just got confirmation today that that change has been made on the flock side, on the program side, for our access. So any data that is collected is kind of written over after the 15 days, unless it is related to a specific case that we're investigating, in which case that data is pulled and put into the case file, a digital case file for investigation.
Commissioner Kwok?
I was wondering, so theoretically, if the federal government wanted to access information that the South Pass Police Department had, would the South Pass Police Department be under any obligation to provide that information?
That's a good question. We're restrained by California law. We're not allowed to share the information, and there's no cooperation currently that exists or that has existed that I'm aware of in the history of our department, as long as I've been here working with the federal government in that capacity.
All right, thank you.
Any other questions for the Sergeant? No. Just one more from me. Has an ALPR administrator been appointed yet, or is that something still in the works?
That's something that's still in the works. I'm going to go out on a limb and guess that you're probably looking at him.
Wonderful. Okay. All right. Thank you, Sergeant. Appreciate your time.
Thank you.
I will entertain a motion to approve South Pasadena Police Department's updated policy 429, automated license plate reader systems. Do I have a motion?
So moved.
Do I have a second?
Aye.
Any further debate? Seeing none, clerk, please call the roll.
Chair Ogui,
Aye.
Vice Chair Lu,
Aye.
Commissioner G,
Aye.
Commissioner Cervantes,
Aye.
Commissioner Sanko,
Aye.
Commissioner Reza.
Aye.
Motion passed.
Wonderful, thank you. Moving on to item number 7 on this evening's agenda. Consideration of the community risk analysis, standards of cover, and strategic plan. Chief?
Good evening, Commissioners. Greg Lloyd, Fire Chief. And I'm here to respectfully request for your recommendation to receive and file this report outlining our proposed community risk analysis, standards of coverage, and strategic planning process, and that we get support of pursuing those consultation services within the FY 26-27 budget. Our fundamental responsibility really is to ensure that fire and emergency services are aligned with both current and projected community risk. As South Pasadena experiences increased mid-rise multifamily development and continues to manage access and response challenges in the Altos de Monterey area, the complexity and concentration of risk are evolving. These changes warrant a comprehensive evaluation of hazard distribution, response performance, deployment effectiveness, and specialty resource capability. The fire department is proposing to conduct a community risk analysis, standards of coverage assessment, to objectively evaluate service delivery considering these conditions. This process will measure response performance by geographic area, assess effective response force requirements for varying occupancy types, evaluate apparatus configuration, including reliance on mutual aid for aerial capabilities. These findings will directly inform the department's multi-year strategic plan by establishing measurable service objectives, identifying operational priorities, and aligning capital planning with projected development. In 2024, and it's interesting that Commissioner G mentioned the study, the fire department was slated for a department analysis around that time as well, but it was the city managers or the city's decision that it would be best to hold off till I came in, had a year to evaluate and to go through. There's two reasons that we're looking to pursue this, and just to give you a little bit of background, these three elements that we talk about, the community risk analysis, the standards of coverage, and the strategic plan. So the community risk analysis will identify current and projected hazards, demographic trends, occupancy types, and geographic conditions. So basically, it's a good overall look at the risk profile within the community. And then the standards of coverage are, what do we currently have in place to meet our current risk as well as projected risk? And so the idea is it's really kind of almost like a gap analysis, right? What is the risk and what do we currently have to be able to address that risk? And then based on those two elements, then a strategic plan would be formed to help bridge any gaps or close any gaps that would have been identified through that earlier process. So instead of really just kind of a smaller department analysis, we're looking at this larger picture within that. There's two reasons for that. One, it gives us a better idea of how we are serving our community from a third-party, measurable, statistical-based analysis. And then also, our goal is to pursue accreditation through the Committee on Fire Accreditation International. There are about there's not very many cities throughout the state and the country that are, so it's a very prestigious thing, but it's a good analysis. There are 243 key performance indicators that align with accreditation. And so we are excited to embark on that endeavor. So really, two things. One, we get a good idea on what our community risk profile is. And two, these three documents are kind of the pillar documents for accreditation. And so as we go through this process, we have reached out to some consultants that specialize in this. Because the impact of this on staff time would be just, and the expertise involved really is not cost effective. And so we were looking at that. If we completed all three of these at the same time, there's a reduced cost because that group is not traveling. They're traveling out once. They can conduct everything that they need to do and then go back. And so we just got that an analysis. So what we're asking for in our 2026-27 budget is about $75,000. We've since reduced that to about $66,000 because that's what we got back from the consultant is really what the cost is in that. And so this document will help really frame the next 5 to 10 years for the department moving forward. We have at least 3 mid-rise developments that are in the planning process right now, with one of them involving about 310 rooms or 310 residences. So that's the Raymond. It's going to be at 625 Fair Oaks. It involves a 7-story building, a 6-story building, and a 5-story building. So it's all in that footprint right around Shakers and that whole area. We have the Mission Bell project, which is on the 1100 block of Mission, which is another 5-story residential. And then there's a smaller four-story mid-rise going in right there at Fremont and Mission. And so we really feel that this is a great way to present a data-driven process for strategic planning in the future to help shape some of our decisions. And with that, I will answer any questions.
Thank you, Chief, for the presentation. Any questions for the Chief? Dr. Senko?
Chief, just to verify, the CRA, SOC, and strategic plan examined both fire as well as emergency medical services calls.
Yes.
Accurate? Okay.
Yeah, so a lot of it is based on response time, areas to serve, and all of that. We look at, we talk about the fire problem in the Altos de Monterrey, but it's also a response problem. If you look at our call volume and all of that, the Altos de Monterrey represent about 15% of our total call volume. That includes, and then about 16% of our fire volume. But for our medical response, that's our difficult to serve area, just because of distance.
So this would include an assessment of likely needs in the coming years of 911 for medical needs as well as fire.
100%. It views it as an all hazards assessment. So community risk in totality, not just fire.
Okay, thank you.
How much will this cost?
It's about $66,000.
Do we have enough for that?
Yes, and in fact, I will go through in our budget presentation for that. It's a one-time fund. It's a one-time ask, a one-time enhancement, and I'll allude to our budget, the budget presentation that we have in a little bit. But we have pretty much shown cost savings throughout the year, and upwards of $400,000. So, yes.
Will the fire department medical director be involved in this process at all?
It's absolutely, yeah. As well as the public too.
Chief, what was the area you said was the highest call volume area? You said something Alta Meridian or something?
So the Altos de Monterrey or the Monterey Hills.
Oh, yeah. You're using Spanish on me. Okay.
Yeah, sorry. Yeah. It did Monterey Hills, Altos de Monterrey, just depending on where you're what you're reading about. But yeah, the Monterey Hills area, it's not necessarily the highest call volume area. It's about 15% of our call volume. But it actually does show it's a hard to serve area as far as response times go.
And you mentioned working with a consultant to get a quote.
Yes.
Would this study go out to RFP, or you already have a contract with that consultant?
So we would adhere to the city's established procurement procedures. So we either go out to bid for it, or we use a cooperative agreement. So whatever the city allows, we'll be following standard procedures for that.
Any other questions for the chief? Commissioner Kwok?
I was wondering, what skill set does this consultant bring to the table that's unique, that helps enable the fire department to be more effective?
So really where they come into is helping to develop the analysis. So it's a lot of statistical analysis, a lot of research, reaching out, conducting focus. It's something that they do better because that's their focus. That's all they do. Could we do it? Yes, but in reality, we don't have staff just around to do this, so we would either be hiring additional staff, paying overtime, and doing that, and we would end up with probably not as quality of a product and spend as much, if not more money.
Chief Lloyd, if you're talking about construction of quite a few units around the city, are you going to have enough personnel as far as paramedics and as far as fire department personnel to cover whatever needs might arise?
So, and that's a great question. And one of the reasons that we're engaging in this is because I could tell you from my 30 plus years of experience in public safety that adding that many residences or that many units into an area is going to have an impact, especially the type of units, assisted living, independent care facilities, those types of things will have an impact on emergency services. but better than going just kind of off of my gut. I want the data and the numbers to show and to represent, because that not only is going to show what we need, but when we need it, so that we can establish a trigger point that when we reach this certain level of development, that we have something already in place. The last thing I want is for us to be upside down in terms of being able to serve our communities and then have to start the planning process. That's way too late. It takes at least 18 months to build a fire station. Right now, it's taking 4 years to buy a fire engine. All of these things take time, and we need to have the plans in place so that we can anticipate the needs so that there is no reduction in service.
Thank you, Chief. Any further questions from my colleagues? Okay, then I would entertain a motion to receive and file the report regarding the proposed use of consulting services to conduct a community risk analysis, standards of cover, and strategic plan, as well as recommend that the fire department move forward with integrating the costs of the services into their fiscal year 2026-2027 budget. Do I have such a motion?
Motion so made.
Do I have a second?
A second.
Any further debate? Seeing none, clerk, please call the roll.
Chair Ogwin,
Aye.
Vice Chair Lu,
Aye.
Commissioner G,
Aye.
Commissioner Cervantes,
Aye.
Commissioner Sanko,
Aye.
Commissioner Reza.
Aye.
Motion passed.
Thank you, Chief.
You're welcome.
Okay, moving on to item number 8 on this evening's agenda, the minutes of the Public Safety Commission special meeting of December 23rd, 2025. Do I have a motion to approve these minutes as amended by the staff per chair, so my comments? No?
I make a motion.
Do I have a second?
Yeah, I can second.
Okay, any debate on these minutes? No? The motion is to approve the December 23rd, 2025 minutes. Chair, please call the roll.
Chair Ogwin,
Aye.
Vice Chair Lu,
Aye.
Commissioner G,
Aye.
Commissioner Cervantes,
Aye.
Commissioner Sanko,
Aye.
Commissioner Reza. Motion passed.
Wonderful, thank you. Moving on to item number 9, the minutes of the Public Safety Commission meeting of January 27th, 2026. Do I have a motion to approve these minutes as amended per feedback?
So moved.
Okay, do I have a second?
Second.
Any debate on these minutes? Okay, clerk, please call the roll.
Chair Ogwin,
Aye.
Vice Chair Lu,
Aye.
Commissioner G,
Aye.
Commissioner Cervantes,
Aye.
Commissioner Sanko,
Aye.
Commissioner Reza.
Abstain.
Motion passed.
Thank you. Item number 10 on this evening's agenda, a discussion on the need to change the start time of the Public Safety Commission regular meetings. So as my colleagues are aware, there is sometimes a conflict in the chamber on the current day that we have, which is the last Tuesday at 5:30. I will say, myself included, and some of my other colleagues forgot that this evening's meeting started at 4:30. I believe the staff proposal is to change the start time to 4:30. I'd love to hear comments from my colleagues, but I think that's a little bit challenging given the traditional 9 to 5 workday that most people work. But any comments on the proposal to change the start time to 4:30 instead of 5:30?
Are there any other Tuesdays where the conference room is not being used where we can start at 5:30?
So I shared the calendar of the chamber's availability with all commissioners to kind of initiate a discussion if there is a specific date and time that you like to entertain, you like to explore, and give me those options so that I can see what works best and pass a resolution, because we do need to pass a resolution if whether we change the time or the date. and I can bring that resolution back for the next meeting. But you all received the calendar, so you can start a discussion from there.
Yeah, thank you, David. So just looking at the calendar and for my colleagues, it looks like Fridays are always wide open. It looks like the first Monday of the month might be available sometime after 5 or 6. It looks like the third Monday of the month is open. The fourth Monday of the month is open. I don't know if you guys have it in front of you, but there's some times that are available if it's not the last Tuesday at 4:30.
Mondays work for me, Monday evenings, but obviously everybody here has busy schedules, and so let's talk.
Yeah, I think Monday, the night before, the night after, the Monday and Wednesday, in the fourth week of the month are wide open. We may think about change from Tuesday to Monday or Wednesday.
So you're saying the last Monday or Wednesday of the month in the evening. What do you guys mean by evening?
Maybe 6-ish.
I like to suggest that I be open. However, I do not want it so late because I don't feel so comfortable driving in the dark.
Would a 5 o'clock or a 5:30 work? And on which day?
Maybe 5:30 or later. It's better for people to join us. People finish their work at 5. They come here probably 6-ish. All other commission meetings start at 6:30.
I propose a 5:30 meeting on either any day of the week, except for Friday.
Can you be a little more specific?
On either a 5:30 p.m. meeting on either a Monday, Tuesday,
Wednesday, Thursday, Friday,
Wednesday.
Saturday, Sunday.
Wednesday or Thursday.
Yeah, if you'd like to explore the calendar more, we can always the commission can always email me, and I can work on drafting the resolution. You don't have to make a decision today, but we do need to clear the room because there is another meeting at 6:30. So this is basically the reason we need to kind of change the time, but there is another commission meeting at 6:30, so we don't have much time today.
Yeah, I mean, if we're still in session, why did they get to kick us out? Shouldn't all commissions be treated equally?
Yeah, but this meeting was supposed to start at 4:30, but it started late, so
Well, actually, the meeting was supposed to start at 5:30. We changed it to 4:30, and three of us.
yeah, we changed it
forgot
because there was conflict. This meeting at 6:30 was before the commission made a decision to kind of make the change. So they had the room earlier.
May we know which commission it is that needs this
The
room?
Natural Resources Commission.
And how often do they meet?
About the same time every other month. So it's the same day and the same time. 6:30 instead of 5:30.
Can we move ours to a different day?
Yes, we definitely can. And the calendars, you have the calendars to kind of make a decision among yourselves to engage in conversation and make a decision. Let me know so that I can draft a resolution.
Councilmember Ferguson.
How you folks doing? Sounds like we got a little bit of scheduling is like herding cats. Have we explored the option of using the library community room?
I don't think there is the recording capability there, but if there is, we can definitely do that. I was told that this is the only room where we can have the commission meetings.
Okay, we've had other commissions that have met in the library community room to kind of avoid scheduling conflicts. And so that might be something to consider, just changing the venue. Then we don't necessarily have to change the time. That might be something to consider. I think that having a time that's like 6:30, I think is ideal for people that are participating. I'd be willing to carpool and give you a ride if that ends up being a problem. So those would be just kind of my suggestions. But again, I just want to throw that into the pot while this decision is being made to hopefully allow you folks to kind of get to some resolution. At the end of the day, it needs to be compatible with all of your schedules. And so thank you. Thank you for your service.
Appreciate that, sir. Thank you. So what's the pleasure of the body? Do we want to table this offline, or do we want to move forward with a motion?
I'd like to make a motion that we move to the fourth Monday of the month at 5:30 p.m.
Okay, do I have a second?
I'll second that.
Can you repeat the motion?
To move our standing meeting from to the fourth Monday of the month at 5:30 p.m.
Here? Yeah. Okay.
and remain here.
I second that motion.
You're third.
Okay, that looks available on the document that I'm looking at, but David, if that is an issue, please let us know.
Yes, I will have to go back and confirm, but once I do confirm, I will draft the resolution, the appropriate resolution for the next meeting to be adopted by the commission.
Okay, so we shouldn't vote on it right now then. Wait till we get the new resolution.
Yes, you do have to adopt the resolution before officially changing the date and time.
Okay, but we are going to explore the fourth Monday of the month at 5:30 p.m. in this chamber.
Sounds good. Thank you.
Thank you.
Can you also evaluate the fourth Wednesday is open as well on the calendar? Just in case Monday is not available, we can.
We do have city council meetings on Wednesdays, so that may conflict. But I will definitely explore that option too. I will take a look.
The fourth Monday in May coincides with Memorial Day.
Commissioner G, I'm sorry, were you done?
Yes, it was for informational purposes.
Got it. Thank you. Okay, sounds good. We will explore those 2 days and stuff. We'll report back. Moving on then to the next item on the agenda, which is information reports. Chief Lloyd will present an information report on behalf of the South Pasadena Fire Department.
Work our way through this here real quick. So first off, we're going to start off. So we are in budget season for the fire department for the fiscal year 26, 27. And one of the things that we did, and I'm not going to go over the entire budget with you and just for the sake of time, but really wanted to highlight a couple of things. And one is we were asked to come forward with efficiencies and innovations. And so just to highlight some of the things that we did here in this past year in 2025, we have purchased, or we are in the process of purchasing 2 automatic gurneys. That was done as a wellness or as a human lifting part to save on injuries. We received funding through the county, the Measure B funding. And so that was originally in our FY 25-26 budget, and now that money has gone back to the general fund. We renegotiated our ambulance billing company fee from 7.5% to 5.5%, which gives us an annual savings of $20,000. We elected to prepay our new fire engine that's coming in 2029. That gave us a savings, prepayment savings of about $104,000, which is about 10% of the cost of, we got about a 10% reduction in the cost. And then also with the Measure B funding, we were able to replace one of our aging monitors at about $66,000. So you can see that not to include some of the cost savings that would be for saving on injuries, on workers' comp and those things, we saved over $300,000, almost $400,000 for those moving into the next fiscal year. We talked about this, $72,000 for the community risk analysis and standards of coverage plan for fire. These are our only requests going into the FY 26-27 budget. We did our budget. We probably, we're either at or slightly below our current operational budget for FY 26-27, with the exception of these two one-time budget requests, the risk analysis consultant, and then the replacement of hardware for fire apparatus from Verdugo. Verdugo is in the process of going through a CAD change to get an updated CAD. With that comes new hardware. Verdugo has already purchased that hardware, and then they will be billing us here in the next fiscal year for that. So about $83,000 total in one time. So based on those efficiencies and savings, you can see that we've covered those things as well. That's pretty much all I have for budget, unless anybody has any questions. Great. We'll move on to the next one. So just to give you a 2025 year in review, as we go through this, just in our mission and vision really coming through and grounded in courage, commitment, and community, and the community focus is something that's been has always been a big part. It's one of the things I love about South Pasadena Fire Department, and so we just continue to do that. There's a picture of our folks doing a Read Across America event at Arroyo Vista, and so had a great time doing that. We are full services, all hazard, and continue to prioritize training. We did 724 hours of training. We've hired 8, 9 new folks here in the last year, and so we've done a lot of training as they're going throughout. Here's our data in 2025, 2,700 total incidents, 2,188 EMS, 370 fires, and 141 service calls. Our most common EMS calls are falls, difficulty breathing, and traffic collisions. And our fire responses are 198 structure fires, 27 vegetation fires, and 16 vehicle fires. That picture is down in the Arroyo, where we continue to, have problems with transient fires in that area, but have seemed to calm down as of late. Notable incidents. So I know it seems like such a long time ago, but in January 7th, if you were not aware that an hour before the Eaton fire started, the Teresa fire started. This was a fire over on Santa Teresa in the Monterey Hills and burned just a little under an acre with no structures lost, no injuries or anything like that. But our folks did an amazing job. We did upstaff an additional engine that day due to the weather conditions. And that was great because the first 2 engines on scene were both South Pasadena fire engines. Other notable incidents, structure fire there on Huntington. That was an apartment fire. We did have a vehicle into a structure there at that turn going down Orange Grove. And then that garage fire actually was on Santa Teresa. It happened just about a month after the vegetation fire just down the block. So for CERT and emergency preparedness in 2025, we did quarterly classes to the public. And then we also held our first annual emergency preparedness fair and teen CERT course. That was done in cooperation with Allison Yam from the Girl Scouts. That was part of her Girl Scout Gold Award project. And so she helped in doing that. And we continue to look forward to doing quarterly CERT classes and then doing that emergency preparedness fair as well here moving forward. We had a badge pinning ceremony here not too long ago. So this will show you that we had 11 firefighters recognized. We have a total of 23 people in the entire department, including myself. So you can see that we had basically 50% of our people were either promoted, hired, or got off probation. So it was a great event, good time to celebrate with families, and just an awesome opportunity really to celebrate the great work that's being done every day, and just the growth of our department. And that's all I have for that. Any questions?
Any questions for the chief?
Chief, just real quick, going back to the budget, what kind of apparatus are we anticipating a year from now or 2 years from now?
So we basically took our exact spec that we have and just made it the next
Same thing.
version.
Okay.
So no big enhancements. It's a Pierce. Puck is the design, and so it's going to look very similar to the one that we currently have. Just be a 2029.
Got it. So, thank you.
All right.
Any other questions for the chief?
And then the last one that I have that's coming up, it will be what we'll do as part of that, and you'll see it in the work plan, is our metrics. So we want to come to you with data every couple months, basically just reviewing what we have. Here's our, response times and turnout times. So if just, these I'm sure will become very familiar to you. A turnout time is the clock starts when we receive the alarm, and then the clock stops when we start responding. So when we go responding to the call. So that's the time that it takes us to get out of the station. And then the response time goes from call received all the way to when we arrive at scene. And so for EMS, you can see in January, we're about 6 minutes or so. So these are the 90th percentile on this. If you were to look at the average of that, the average would be a lot less than that. And the reason that we use the percentiles is because the majority of our calls happen very close to the station. So we don't, if you use just an average, you will not see the outliers. You will not see the calls that go into the Monterey Hills. And so because the frequency tends to drag those numbers down. So when we use the percentiles, you can see the numbers that have gone up. We're really close. We want to be at that 5.5 minutes. And so we're getting close to that part as well. Our monthly statistics, so turnout time is just under 1.5 minutes. Response time, 6 minutes. Fire turnout time, 1:55, and then fire response time, 6:29. We had 229 total calls, 40 fire calls, 177 medical, 12 service. So there's the other one that we want to track too. We go out of the city 61 times as part of our automatic aid, as a responsibility as a mutual aid partner to Pasadena, Alhambra, San Marino, in those surrounding areas. And then when we're occupied on a call, then we rely on that mutual aid by other units coming into the city. So you can see it's a little about a balance right now, but pretty consistently throughout the year, it's close to even. The only thing that gets affected on that is the response time, because you have a unit responding from a farther distance. So this is February, a little bit more. Looks like we're going out of the city a little bit more, and that's something that we're going to want to track. If that's starting to trend more, that we're heading out, then we want to have those questions, those answers. Significant responses. So in January 24th, we were dispatched to a reported fall up off of Hanscom Drive. A gentleman fell approximately 200 feet and had to be rescued. And so we had a large response that combined Pasadena Fire, Glendale Fire, as well as South Pasadena to those areas as well. Top 5 call types this month: fire alarms, shortness of breath, falls. Falls consistently trend to be the number one, but it looks like shortness of breath kind of went over that this month. Could be possibly because of the time of year. But that's some of those data. Those are all those things that we can help take action on and all that. Any questions?
Chief, thank you for this comprehensive view. So this is going to be a regular report to?
Yeah, so we'll come to you with a 2-month report at every meeting.
Is it feasible to request additional items?
Absolutely.
Or to consider additional items, not just EMS response, but EMS response to time critical emergencies specifically. So your diff breathers, your major trauma, your unconscious
Absolutely.
items in particular.
Yep.
Also, is it possible to sample our APOD times at the different hospitals to understand the burden at the different facilities and how much time that accounts for time in service for our members?
Absolutely.
What was that acronym?
It's ambulance patient offload time. There's been a statewide effort to decrease the elapsed time that our ambulances are holding the wall at with patients at the hospitals and not able to get back in service to respond to local emergencies.
Yeah. Just to give you a real brief on that, it started probably around 2021, 2022 at hospitals. What would happen? So when an ambulance transports into the ER, they bring a gurney, they wheel their gurney in, they give a turnover to the nurse, and then the patient is moved over to a hospital bed. At some point during that time, the nurses have held the ambulances, not taken the report, and they basically just hold the wall, and they say, we'll get to you. So what that does, and it's whether it's a staffing issue, a bed availability issue, or any one of those things, those units are there. On a, we're talking 15 to 30 minutes on a short end, hours on a long end. I have my son currently works in Riverside County, and he's on an ambulance, and he's held the wall for 6 hours. So it can be very dramatic. We don't see those here, at least we're not seeing them within South Pasadena Fire Department. Huntington's been very good about moving people off just because they recognize the impact that it has on the system as well. But this is something that, as Dr. Senko mentioned, is a statewide issue right now.
I actually have a question for my colleague, Dr. Sanko. Do you think it would be of use to figure out in our community response to stroke, heart attack? Would that be of use?
Yeah, I think it would be very insightful to have a breakdown of provider impressions, and given the volumes, it would even be interested to see just like a 2 or 3 year breakdown, top provider impressions. If you have a breakdown of ALS2, ALS1, and BLS runs, which are dispatch level of service, and also even if it's just anecdotally, your top 5 high utilizers, and if there's been any engagement with their sites, their families, or them individually to mitigate and try to resolve those problems or link them to additional services, or if there are ways that we as a community can seek to do that without, meanwhile, protecting their privacy,
Right.
obviously,
Exactly.
but so we can make sure that with this increasing burden, with these additional buildings coming up, we're being thoughtful about
Sure.
about how we keep our members available for the next time critical emergency.
Absolutely.
So I also don't want to overburden you with analyzing the statistics, but maybe just the top 3 or, whatever my colleagues think is important for whatever the state considers as important.
Yeah, I'd say your top 5 provider impressions, your transport rate, and if it's possible to break down dispatches into ALS2, ALS1, and BLS, if those are available.
Sure. I've seen a lot of that information coming out of the county. So I'm sure if we can just filter that down to our agency, we could probably get those numbers. It doesn't sound like a very arduous task. So,
Chief, just one thing. I'm a very visual person, so maybe whoever the Excel expert is in your office, if we could try to scale the graphs. I know that it looked like there was a tremendous jump, and it was literally 1 second, but it wasn't really to scale. If we could try to work on that, that would be appreciated.
absolutely. Well, yeah, I'll apologize. We'll take care of that.
Just one last comment too. I've heard from the pre-hospital care coordinator over at Huntington that South Pasadena has had and maintains a great reputation. And hearing about these unique incidents, or hearing about EMS incidents as well, wherever feasible, is helpful for us to keep in mind all the life-saving response and work that your team is doing.
Absolutely. Perfect.
Thank you, Chief. Appreciate the report.
You're welcome.
All right, let's try to wrap this up here. Council liaison communications. Mr. Ferguson, anything to report?
I'll keep this as brief as possible. One of the things that I just kind of want to talk about as it pertains, Chief, to the analysis that you're going to have performed is that oftentimes, I guess when was the last time this was done within the city? Was something that I would want to know. And then also, if you can kind of speak to how performing these types of analyses help us when it comes to applying for grants, et cetera, once we do these risk assessments. Can you just speak to that a little bit? I think it'll be beneficial for the commission to hear.
Certainly, and as we were talking about, so there's two big things. One is that whenever we're looking at trying to do studies that address risk, it's always there's always a request for the data that's going to support that. And so to have an analysis already completed helps move us to the front when we're applying for that, because what it shows is that we've already identified the need, and then we're asking for the solution for the already identified need. The other part that's important about this is to go through the accreditation process, which involves 243 key performance indicators that help basically bring just shine the light on every little area within the department and areas that we can improve with that. But it also can move us towards potentially improvements with insurance companies and those types of things as we seek to help with those different aspects. Yes.
And then, do you know the last time we did one?
If it was before, we haven't done it before or after 2018, so it's been almost 10 years. Yeah.
Okay. Thank you. Just
You
wanted to get that context in there. I want to mention that there was just of note that there was a pedestrian that was struck by a vehicle near the elementary school Arroyo Vista. I just want to kind of remind the public and commissioner as well, like the police department still conducting their investigation. And so we want to make sure to give that time and space to get done. Obviously, we want to do as much as we can. We also want to make sure that we cross our T's and dot our I's as we think about how to address this stuff going forward. So thanks for the efforts in getting that done. And I think that's about it. So anything else that you have for me, feel free to reach out and let me know.
Just a question for you, sir. We had agendized last meeting, not last month, but last meeting, a presentation from the city manager's office on the changes to the commission structures and meeting frequency. I know some of us were not particularly thrilled about the lack of communication, and I believe we mentioned this before. Nobody came to present on that item.
Okay.
Which was very unfortunate. I would ask if you could pass that along.
Like that.
Not only were we not communicated with prior to the changes being made, but nobody came to tell us about the changes after they were made. So I know, just speaking for myself, that was pretty disheartening.
Yeah. Let me make sure to circle back with city manager and kind of get something on the books for that.
Anything else for the council member?
Get him while he's here.
Appreciate your time. Thank you.
All right. And, Commissioner Lou, you're going to have to move your name tag. I was like, these guys aging in reverse. Your name tag's over here for the youth, our youth commissioner.
Thank you, sir. Staff liaison communications is the next item on the agenda. Chief Lloyd, anything else other than what you've already said? No? Okay. Chief Elmore, Deputy Chief Landenheim? I'm going to get that right one day.
Just
Chief
wanted to thank the commission and come back and let you know that we do have text to 911.
Is that PDN fire?
The 911 always is routed through PD first. So yeah, they would have that capability.
But you need to be physically in the city when you send the text?
Correct. For it to go to South Pasadena, correct.
Wonderful. Good news. Thank you.
Yep.
Anything for Chief Elmore? Nope. Okay. Thank you, Chief. All right. Commissioner Communications. Any of my colleagues have anything they wish to share? Seeing none, with no further items or comments from the commission or staff, I will adjourn this evening's Public Safety Commission at 4:23 p.m. Our next 6:43 p.m. Thank you. Our next regular meeting will take place on May 26th, 2026 at 4:30. It looks like again, 4:30 p.m. Thank you. Have a good evening.